Is your doctor prescribing drugs that you don't actually need? This may sound surprising to some of you, for others not so surprising if you've been in this situation. But I found out that over 25% of doctors admit to prescribing medication that they know is not going to have any therapeutic benefit for their patient, and that over a million, what was it? It was, yeah, over 1 million ER visits and 350,000 hospitalizations take place every year in the US due to adverse drug reactions. So it is a problem, and specifically in my area of treating hiatal hernia syndrome, we see this a lot, and it makes sense because we live in a medical model that's very geared toward find the disease. This is the recommended treatment. This is the standard of care treatment for this disease, and it's typically always a drug. And so the problem with hiatal hernia syndrome is that, yes, the person can often start with acid reflux, which the doctor goes, oh, okay, I know what to do for that. Here's your PPI, right? Here's your antacid. What they don't know what to do with is the secondary and tertiary effects of the increased intra-abdominal pressure in your gut, the loss of the proper mechanics of your diaphragm that lead to heart palpitations, shortness of breath, anxiety. Now the list is much longer than that, but I'm going to focus on those three because that's where we commonly see medications prescribed that a patient does not need. So how can I state that so emphatically is that the person goes to a cardiologist, gets a full workup on their heart, and their heart is deemed healthy and fine. Yet they still leave the cardiologist's appointment with what? A drug to slow down their heart. There's nothing wrong with your heart's not diseased, but you are bothered by these heart palpitations, so let's slow down your heart. Now, there are a lot of side effects associated with slowing down your heart when you don't have heart disease. So you can get dizzy and lightheaded and pass out, and these are not mild effects. Now, what about the shortness of breath? So you go to a pulmonologist and they do a complete workup on your lungs, only to tell you, your lungs are great, they're perfectly healthy. Let me give you an inhaler. This is what we give to patients suffering from asthma. Well, doctor, I don't have asthma. No, I know, but you have shortness of breath, so this might ease your symptoms. Now, of course, the asthma medication has its own set of complications and side effects associated with it. Then we have the anxiety. Now, for that, they're very quick. Oh, you have anxiety, you have depression, got just the thing for you. Here's this anti-anxiety medication. Not looking into the fact that this person is not an anxious person typically. They don't have a long-term problem with anxiety or depression. They've had it since the whole hiatal hernia syndrome started for them, but the doctor isn't seeing that correlation. They're just saying anxiety equals drug, here's the drug. Now, these drugs have very dangerous side effects, and there are some really good studies showing that exercise works better for depression and anxiety than do these SSRIs. So, and other medications like that. And of course, exercise doesn't have the side effect of suicidal thoughts and tendencies. So I speak from a lot of experience from my team and I of patients who just say, well, my doctor put me on this and I'm not actually feeling that great on it, but he said, she said, it might help with my breathing or it might help with my heart palpitations. And then with the anti-anxiety medications, patients do report, yeah, I do feel less anxious, I feel calmer. But what's the problem? We have all these side effects, very dangerous side effects associated with these anti-anxiety, antidepressant medications, and the root cause of the problem is not a brain problem, right? It has to do with what happens to your nervous system when you're not getting enough oxygen, and what happens to your vagus nerve when it gets irritated. And these are things I go over in a lot of other videos. But I wanted to speak today because this happens over and over and over again. Yeah, my heart's fine, but I'm on a med. Not sure why, So here's the point I wanted to make. I mean, I've been doing this for 40 years, and I've had patients of ours who their doctor threatened to fire them if they didn't follow his or her recommendations. So they would do things like lie to the doctor about taking medication that they had long since stopped because they had done our program. Or another interesting one was a woman with type 2 diabetes that we had reversed, and she took her medication once a week so she wouldn't have to lie to her doctor, and she could say she was still taking the medication. It's kind of crazy, where we are with this, but the fact is it's your body, and it's the only body you get. So what you want to do is ask that question and say, okay, doctor, so why are we giving me this heart medication when you just said my heart was perfectly healthy? Well, I think it might help with your heart palpitations. Right, so we don't really know why I have heart palpitations, is that right? No, I really can't see it. I can't see it in your heart. Okay, well maybe something's affecting my heart, which is absolutely the case in hiatal hernia syndrome. And I know our traditional doctors don't think that way, but the facts are that what we do here at Root Cause Medicine, the field of functional medicine, is really expanding, and you deserve to find a doctor who can help you, who thinks that way, who thinks about root cause, who thinks about, okay, we have an organ that seems to be malfunctioning, but it itself is not diseased. Okay, so clearly it's being affected by something. What could that be, right? This is the thought process that you deserve to have occur for you. And so that's what I wanted to share with you today, because the facts are that especially as we get older, Americans are put on more and more medications. A lot of these medications, as soon as you go above, I believe the number is 4, then there's absolutely adverse effects being created between the medications. Not just the side effects associated with each medication, but now they're playing against one another and creating side effects. And a lot of them are mental, neurological. So you have brain fog and memory loss and almost Alzheimer's-like symptoms associated with these side effects of these medications. So bottom line is we are here for you. We're delighted to help. We do have an 85% success rate. We do treat patients across the country. And, it's okay to stick up for yourself politely with your clinician and ask, gee, I'm on 5 medications. What can we do, to decrease some of these? And I do appreciate that can fall on deaf ears. I completely do. So it's time, if you can, to find a clinician who's not deaf to what you're saying and really listens and really understands what to do. You deserve that. So if you like this information, please share it with others. Subscribe to the channel so more people can see this information, and I'll talk to you soon.